Hi, I'm Dr. John Nosti, and I'm here to talk to you about full arch appliances. By far, the full arch appliance has been the longest and most widely prescribed appliance in dentistry, and it has served the profession and patients very well over the years. It has been used as a protective appliance, as a diagnostic appliance, as a palliative appliance, but unfortunately, it is also the most widely misused appliance, I feel, in dentistry. Now let's go over the full arch appliance provided to us by Keller Laboratory. What I like about Keller's appliance is that it is made of their proprietary crystal clear 450 acrylic material. Now this material is virtually unbreakable clinically. Now, why on my appliance that I prefer to have anterior guidance is because when we go into a lateral excursion on a flat plane splint and the posterior teeth contact, this allows the elevator muscles to contract. When this happens, people can have increased temporalis headaches, or even have, say when they wake up in the morning, that their jaw feels tired or their face feels uncomfortable. So I want to provide them with the most physiological, beneficial appliance possible. And that appliance is one that has an anterior ramp to provide anterior guidance in the appliance. Let's discuss some indications and contraindications to full arch appliances. Some indications for these appliances would be a protective appliance for your typical patient who grinds their teeth at night. They might be asymptomatic as far as headaches or muscle pain or really having any complaints, but we want to provide them with an appliance to protect their dentition. We might want to prevent them from wearing their teeth. So that's an indication, our first indication for this type of appliance. And a second indication for this type of appliance is an occlusal muscle pain patient. These patients are typically lateral bruxers. So before, when I talked about my design of the appliance with an anterior guidance ramp built in, this is where you want to prescribe one of these types of patients. Patients who are lateral bruxers, they might have tired muscles, sore pain, occasionally get a headache. These are ideal for those types of patients. Another indication for a full arch appliance would be a patient with an internal derangement or TMD. These patients may be symptomatic or asymptomatic. Now I know a lot of dentists out there don't feel comfortable prescribing segmented appliances or an anterior appliance for these types of patients. An additional indication for these types of appliances are patients who are fearful of the smaller anterior appliances. Even though there has been no history or reported problems with segmented appliances, some patients don't feel comfortable with such a small appliance knowing that they're going to wear it to bed at night. So I would provide this patient with a full arch appliance. And lastly, an indication for a full arch appliance is if the dentist wants to track the occlusion of the patient, maybe prior to a rehabilitation or to see if their occlusion has remained stable long term. Contraindications to a full arch appliance would be patients who have migraines, patients who are vertical clenchers, or patients who are vertical bruxers. So the reason why it's contraindicated with a full arch appliance is even though with my design, having an appliance with an anterior ramp, if a patient is a primary clencher, the full arch appliance does not shut down the elevator muscles when the person clenches, because indeed the posterior teeth are in contact. So if we want to take advantage of shutting these muscles down, we typically want to use an anterior appliance. I like to prescribe my appliance based upon how the patient presents to me. So let's go over where I might use the maxillary versus mandibular arch. I'll choose to prescribe a maxillary appliance when patients are asymptomatic bruxers, that they're using it as a typical night guard. I'll use it on patients that I've just done cosmetic work on and they need a protective appliance. Now, where I'll choose to prescribe my mandibular appliance is if I'm treating a patient with a temporomandibular joint disorder and they may have to wear this appliance more often than just at night. Maxillary appliances, we know, are very difficult to talk with. And I've found that it's just more comfortable for these patients to wear a mandibular arch appliance than have the maxillary arch covered.